Good evening. This is Dr. John Bennett, broadcasting in a series of Parkinsonism educational hangouts with Dr. Abdul Rana, neurologist from Toronto and world-renowned Parkinsonism educator. Tonight, Dr. Rana is going to be talking about something we've all been waiting for: autonomic dysfunction and sexual dysfunction in Parkinson's. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay, I'll start things right off with how does Parkinson's affect sexual function?
The sexual dysfunction happens in at least 1/3 to half of patients with Parkinson's, and autonomic nervous system plays a very important role in causing this problem. Usually, it's perceived as a problem of men when you think of sexual dysfunction, but women with Parkinson's disease are also affected with it. And a significant number of females, they have a decreased libido, they have a decreased orgasm, and men, of course, they have erectile dysfunction. Usually, it starts after the onset of Parkinson's disease, maybe a few years after the onset of Parkinson's disease. It does not start at the beginning. If it happens at the beginning, then usually we may consider other diagnoses such as multiple system atrophy. Beside the slowness in the performing sexual activity, patients also have a very obvious tremor, and they may have other symptoms such as dry skin or drooling, and also depression and anxiety. So these problems could exacerbate their issue of sexual dysfunction, and it could further lead to the anxiety as well as depression and frustration. So patients have a decreased libido, both men as well as females, and they can't maintain erection to achieve the orgasm. The two main causes of sexual dysfunction, the organic and psychogenic. So in case of Parkinson's, they both combine because these patients do have organic dysfunction due to autonomic dysfunction, and then this creates an anxiety, especially in men not having a erection or failure to achieve orgasm. It causes a poor self-esteem, and also during the act, they feel quite anxious. So this anxiety builds, and anxiety further causes their sexual problem to be worse. So it is like a vicious cycle. So you can't perform, you get anxious, and then anxiety makes you not able to perform. So it's a combination of both, the organic as well as the psychogenic issues. Sometimes these patients have coexistent medical conditions, such as they have diabetes mellitus, and they have polyneuropathy because of this, and vascular disease can also lead to poor blood flow, which causes a failure to attain and maintain erection. And on top, if they have high cholesterol, smoking, and atherosclerosis, these factors may contribute to the overall problem. And some of the medications, such as beta blockers or some antidepressant, they could affect the sexual functioning as well. So as a physician, so we should look at it, all the factors, the organic factors, coexistent medical conditions, as well as medications. And in addition, in males, they could have prostate problems, and the prostate problems could lead to these issues as well.
Okay, what can be done about these problems?
It's a difficult symptom to manage. First of all, the history is really difficult because patients feel quite uncomfortable to talk about this with the physician. They may not bring this topic in discussion, and females could be shy as well, and males the same way. So you have to take a lead. You have to ask them that is Parkinson's affecting sexual functioning? So then they might give a very little information. So you have to be persistent to take that history. So it is such a symptom that people feel quite shy or anxious to talk about this. And sometimes if you are taking history in the presence of a family member, you might ask the patient to be seen alone, and you can take history, except if you have a spouse with them. The other factors should be ruled out, such as medications, which are an important factor, and diabetes mellitus. If patients have a poor glycemic control and they have long-standing history of diabetes mellitus, there could be a problem. And then anxiety and depression could be an issue as well. Most patients may not have a major depression or very obvious symptoms, but they could be dysthymic. They could have mild symptoms of depression, and that could affect their sexual performance. Because when you ask patients symptoms of depression, they would say that I'm not depressed. So you have to be very careful, and you have to screen them for dysthymia, which can contribute to this problem. And then advising patients to maintain their sexual activity, that would help. And also being in a relaxed environment when they're with their spouse. They should be very relaxed. And a frank discussion between the partners is very important. They should discuss this in detail. And then they should also sometimes seek the other methods of intimate relation, and psychosexual counseling could help some patients. And there are some devices which are non-pharmacological devices, such as vacuum pumps. They usually don't have any side effects, and they're easy to use. And patients can buy once, and it could last for a longer period. It can be used many times, and they're usually cheap. And in addition to this, there are certain medications which could be used. Before going to that stage, patients should be advised if they could reduce their stress level, anxiety, and smoking, alcohol consumption, and if they can reduce their weight, that is helpful as well. You may need a urology consultation for ruling out other causes or a basic assessment. And then if this is attributed to Parkinson's disease, then of course certain medications such as sildenafil could be used in some patients. However, it should be used only under supervision of physician, because it could cause orthostatic hypotension, headaches, and many other side effects. Sometimes dopamine agonists, which are usually used in patients with Parkinson's disease in a relatively younger population in early stage as a monotherapy, or sometime in moderate stage Parkinson's disease in combination with other medications. So they could also helpful, although it's a side effect of those medications, but it could be a useful side effect of these medications. Other than this, there are probably some surgical procedures such as surgical implants and semi-rigid rods. However, in day-to-day practice, we don't have much experience in treating patients with these interventional methods. The certain medications, such as dopamine agonists, which are used for treatment for Parkinson's disease, as I was just mentioning, sometimes they could cause behavioral issues. They could cause impulse control disorders, and hypersexuality is one of the side effects of these patients. And this could lead to problems both ways. Sexual dysfunction itself could cause problems between the spouses, and it could lead to serious issues. And on the other side, if patients develop this side effect of hypersexuality, this could also lead to problems. I had a patient, he was 69, and we were giving him Mirapex in combination with levodopa. When the dose of Mirapex was increased, so this person developed hypersexuality. But when we saw him in follow-up, he did not report it. And even when he was asked, he said no. So once his wife came with him, and when we were screening him, so she said yes, of course, he is very much overactive, and this poor lady had a stroke, so she wanted me to stop these medications, and he wanted me to increase medications. I was stuck in a dilemma. So these situations can happen in some of these patients. So if patients feel such side effects, they should immediately contact with their physician, because one, they could lead to problems in between spouses, and the other thing is that they could also be accompanied by other side effects of a similar nature, such as shopping, compulsive shopping, or gambling, or sometimes people start buying one type of thing. I had a patient who was just buying screwdrivers, and his whole garage was full of different types of screwdrivers. He developed the side effect of a dopamine agonist medication, and he would go to each store. Sometimes he'll go to Home Depot, other time he'll go to Rona. He will buy different types of screwdrivers. So then once we stopped his medication, then this side effect went away. So in these cases, if patients do develop impulse control disorders, then these medications have to be reduced, or in most cases, they might have to be stopped. I think this topic is of special importance. The most important point in this is that patients are somewhat hesitant because of modesty to discuss this with the physicians, and the physician should take a lead to discuss, and this should be discussed with both spouses. And the parallel history is quite important, and this should be addressed, of course. So I think this problem of Parkinson's disease is of special importance in lives of people. I can't hear you.
Hear me now? Can you hear me now?
Yes.
Okay, there we go. Okay, Dr. Rana, thank you very much, and we'll see you at the next Hangout.
Sure. Thank you.